Hello, my name is Mitchell, and this is my video critique for Abbie Evard of her cardiovascular, respiratory, and perivas health assessment video. And so I want to start off just by beginning saying that you did a very good job when it came to the flow and making sure your patient was nice and comfortable throughout the whole procedure. You hit on the majority of the points that were needed. There were a few that you kind of skipped over, but for the majority of it, you did a pretty good job when it came to that. One thing I really thought was good was how you involved your patient with the actual part of the examination, talking with them, making sure they understood what was expected of them and like what they needed to do to kind of help out. I just want to start off with some critiques, just to kind of help you out with your head-to-toe video. So, looking at the paper I have here, when you were, it sounded like when you were listening for your cardiac, when you listen to our heart, that you need to, it might benefit you to do a little review on the 5 points that you need to hit, which are the second intercostal right sternal border is the aortic area. Second intercostal space, left sternal border is the pulmonic area, which you go down one. The third intercostal space, left sternal border, is Erb's point. Then the fifth intercostal space, left sternal border, is the tricuspid area. And then the fifth intercostal space, midclavicular line, is the mitral area. And so those are the big ones that you want to be able to make sure you have memorized when you go to do your head to toe. And also what the expected and abnormal findings would be when you listen to those. So that would be like any murmurs or whooshing sounds, anything along the lines of that, any adventitious sounds that aren't supposed to be there. You want to make sure you know the terminology for those. The next thing was with the posterior lung fields, you did great. You hit almost every spot you needed to do. One thing you want to do is make sure you listen up into the lateral aspect as well. The lateral lung fields. But there was one thing with the anterior. You skipped over the anterior aspect of the lung fields. So essentially, you didn't listen to the lower or the upper lobes as much as you did the lower lobes in the back. So that's one thing you definitely need to consider when you go to do your next video. Was to make sure you hit the anterior lung fields as well. And so next, all throughout, you did a pretty good job hitting, asking a few questions for each system. But you want to make sure you want to go more in depth with cardiac and respiratory, asking about family history, their past history, if they've had any problems, fatigue, shortness of breath, all that stuff, because that all is indicative of underlying issues that may cause problems in the future. One thing I did notice when you were in the posterior, when you said you were listening for tactile firmness, you actually did the motion for symmetrical expansion, which symmetrical expansion is when you place your thumbs at T10 and have the patient take a deep breath in, and you expect to see your hands expand symmetrically. When you did that, when you said tactile firmness, which is the 99, placing your hands in the back, feeling for the vibrations through the lung tissue. So you want to make sure you get the terminology there right. And then you also, one thing you skipped over was palpating for crepitus, which is air in the subcutaneous tissue. So that just you feel around the back, making sure palpate. And you feel any cracking or popping, that's indicative of crepitus. So those are a few things that you want to make sure to review a little bit on before your final head-to-toe video. But other than that, you did a really good job, and I was impressed. So good job.